Dr. Prerna SINHA will speak on Meibography-guided electroepilation for congenital dystichiasis, a novel surgical technique.
Thank you, ma'am. Hello, everyone. I shall be taking you through a novel surgical technique which we use in congenital dystichiasis cases. So dystichiasis, as we know, is extra row of lashes arising from meibomian gland orifices. The depth of these lashes is still unknown, and it varies from 4 to 4.5, which has been proven in one study, basically, by Wolfley. The treatment, as per the treatment is concerned, here you can see electroepilation, which is needle-guided using radio frequency. But this is a blind procedure, and hence recurrence rates are high. Other treatment modalities are lid split with or without tarsoconjunctival graft and cryotherapy in lid split lamellae. So we aimed to describe a novel surgical technique using meibography to guide the electroepilation in cases of congenital dystichiasis. We prospectively recruited patients presenting to our tertiary care center over a period of 1 year, and we included 6 patients. All these patients, after a thorough history taking, underwent slit lamp examination and photographic documentation of the eyelid margin to count the dystichiatic lashes and meibography. So all 4 eyelids underwent meibography on eversion. And as you can see here, we can see the roots of these dystichiatic lashes. And for the evaluation of the depth of these lashes, we used ImageJ software, wherein we used the distance between 2 adjacent lash follicles as a scale to measure the depth. And then routine electroepilation was carried out using a 29-gauge needle. But here we used a needle which was pre-marked at 2.5, 3, 3.5, 4, and 4.5 mm. The surgery was performed under an operating microscope. And a radio frequency current of 4 milliamperes was used in spurts. So our cohort of patients had an equal gender distribution, and 50% of them had a prior history of electroepilation. 2 patients did not opt for the intervention because they already had history of electroepilation. So out of the 123 dystichiatic lashes in the upper eyelid and 107 in the lower eyelid, the meibography revealed the roots of these lashes in 87 in the upper lid and 94 in the lower eyelid. And the average depth of this dystichiatic lashes in these patients was 2.9 plus minus 1.1 mm. The anatomical success in our patients was 75%. That is, 12 out of 16 eyelids had anatomical success with absence of regrowth of dystichiatic lashes, and 87.5% eyes had surgical success with minimal eyelid edema and lid margin pigmentation. There was no eyelid margin irregularity, trichiasis, or entropion at the last follow-up visit. This is the left panel shows clinical image of the dystichiatic lashes in one of our patients. The middle panel shows the meibography images showing the roots of these dystichiatic lashes, and the right panel shows the outcome, where we can see only margin pigmentation, lid margin pigmentation is there, and the dystichiatic lashes remaining in the temporal quadrant. So though various studies have been described in literature, they are mostly surgical interventions, and they all have their sets of limitations. So we thought of going ahead and using this non-invasive tool to aid the commonly performed electrocautery for dystichiatic lashes to basically make it more robust and with a definite outcome. The limitation of our study was a short follow-up and inability to capture the dystichiatic lashes at the extreme ends of the eyelids. This study highlights the understanding of dystichiatic eyelash depth and direction, application of meibography, a non-invasive tool in guiding electroepilation, and having a quicker recovery time. I would like to conclude by saying that a longer follow-up with a larger sample size using meibography-guided electroepilation with a comparative arm could pave a way to better understanding of these lashes.